Cancer Center of Guam oncologist Dr. Sam Friedman says we have a crisis in our hands.
Florida Infusion was the largest supplier of chemotherapy drugs in the U.S. They were a multi-billion-dollar company, and for years we've been getting our drugs there. And also Rene Ramos from Express Med in Parisville and MedFarm, he owns these, was getting his drugs there, and he supplies the MIP and Medicaid patients with the drugs. Everything was going smoothly, providing he was getting paid so he could order the drugs. Provided he was getting paid from Guam so he could order the drugs to supply them. And it was running fairly smoothly, and all of a sudden, without any notice, Florida Infusion decided to close its doors, and we were told a week before they closed their doors. Everything was going smoothly, providing he was getting paid so he could order the drugs. Provided he was getting paid from Guam so he could order the drugs to supply them. And it was running fairly smoothly, and all of a sudden, without any notice, Florida Infusion decided to close its doors, and we were told a week before they closed their doors.
Friedman says they've written other stateside wholesalers, none of whom are showing interest in supplying Guam. What does this mean for cancer patients receiving active treatment?
We probably have somewhere around 150 patients under active treatment at this time. And it affects them. And of course, anybody who falls sick with cancer now and needs treatment, we're going to have problems finding the drugs.
And supplies are running out. Prior to Florida Infusion's closure, Friedman says a large supply was purchased. But that was a month ago, and active drugs are dwindling with a higher demand for biodrugs, now more commonly used to treat cancers. Friedman says biodrugs must be iced when shipped, adding to its cost. He adds, even if we identified a willing vendor, prices would be more than any insurance company or Medicare could cover.
Because we live on Guam, all the drugs are shipped free overnight in the U.S. mainland. If you're on Guam, it costs you $400 to $600 to $700 every time you make a shipment. Medicare will not recognize that. Even from Florida Infusion, most of the prices that Medicare were paying was less than what we were paying, and you have to add the shipping cost to this.
What's next?
I don't honestly know what the next step is. I think the patients feel even more helpless than we do because they don't know what to do. And we've been trying and not running into any good luck.